technical hiccups there. Hi, so my name is Larry, and this is Dr. Ahmed, and I am with On Point Movement and Performance, and we're interviewing Dr. Ahmed and her partner. And go ahead and what's the name of the signature concierge clinic? Is that what it says on your? I'm trying to read
Yes.
your.
Thank you, Larry, for giving a chance. Yes, I am Dr. Humera Ahmed, and that's my partner, Dr. Dina Diehl. So we have a
Awesome.
clinic, opened a clinic together, and it's Signature Internal Medicine, and it's in Frisco.
In Frisco, Texas. Yes. So y'all are just north of me. So I'm in Richardson, Plano area. My clinic's in Richardson, and we do mobile concierge physical therapy. I think your partner was asking. Remind me again of your name, your partner's name?
Dr. Dina Diehl.
Awesome. Awesome. Well, good to meet you. And yeah, so y'all are a little bit north of us, but I wanted to meet y'all. I've taken some of Dr. Ahmed's patients prior to y'all starting your clinic, and that's kind of how I knew Dr. Ahmed, and we were Facebook friends, and so I wanted to interview you. I saw you posting about kind of your new practice, and me being a relatively new practice, I wanted to get y'all some exposure. And so my plan is to kind of send out this podcast to a lot of my clients, and I do have Frisco clients, and so and I know y'all do a lot of good stuff. And so the first thing I wanted to do with both of you ladies is just tell me a little bit about who you are, not necessarily your clinic, but maybe just who you are, maybe some experience. Tell me about your family. Tell me about your experience, and just anything else you want to share as far as just maybe it's values or faith or anything like that. So
I'm Humera Ahmed. I'm board certified in internal medicine and obesity and trained in functional medicine. I started my practice from Texas Health Presbyterian Hospital Plano as a hospice. So we both were hospice for 5 years, and then we transitioned to outpatient clinic together, and we were still working for Texas Health for 10 years. We both were traditional primary care physician, and we loved it. We enjoyed it. But with years went by, we just dealing with a lot of limitation, which was not going well with the patient care. So Dr. Diehl came up with the idea of opening the concierge practice. And basically the concierge practice more personalized, more one-to-one care that we can able to provide better care to our patient. And that's why we opened concierge practice together in 2022. I'm going to have Dr. Diehl to say more things about our practice and about herself.
So basically,
and yeah, just a reminder right now, I just want to hear about you guys. Like, tell me a little bit about your family and your experience. We'll get into talking your clinic. That's going to be my second follow-up question. Yeah, just tell me a little bit about, tell me about you, the person, about yourselves. Yeah.
Okay, so I moved to Texas and US basically in 2000. And I got married. I have 2 children. And my hobby is, believe me or not, my profession. I mean, I love being a physician, a doctor. I love being working as a doctor. I never hated my job. That's my hobby, like patient care. But yes, we do a lot of family activities together with my kids. What else shall I tell you?
Yeah, what kind of activities do your kids do?
So my son is 20 and he's doing pre-med. So we are hoping that he's going to the medical line. He also plays a lot of basketball, so we watch a lot their games. My daughter is 13 years old and she involved a lot in volleyball. So we definitely spend a lot of time watching their games together. We also try to plan our vacation travel. I love reading books, which is mostly the medical books. So I have a book club where I go and join a different physician and listen to different books. So I love reading books. More interesting hearing about people concept, idea, and recommendation on the book. So I do that. We also do a lot of I have a huge family here. My whole family is here, so we are very close to each other. We have a very close family.
Awesome. Awesome. And your
Love
partner there?
exercising, love
Oh.
swimming nowadays.
Swimming. That's how you stay fit and keep your heart healthy.
Oh yeah, I'm focusing a lot on my health and a lot of lifestyle, I think. So
Yeah.
a lot of exercises, a lot of swimming. That's the best time I can spend nowadays. I have more
That's
time to
awesome.
do it.
Yeah. I'm more of a CrossFit guy, so I do CrossFit.
Ah.
Yeah.
I
Awesome. And your
guess a little
partner,
bit
tell me a little bit about yourself over there.
Yeah, so I'm originally from Pennsylvania. My husband and I moved down here in 2008. And I also have two children. So we started a family when we came down here. I have a son who's 15 and a daughter who's 12. Same kind of career path. Dr. Ahmed and I actually met when I first moved here, as we were hospitalists together. And then we, both together opened the practice at Texas Health. And then now we have our concierge practice. But from back to more personally about myself. So basically, what I like to do, I guess, in my spare time, I mean, a lot of time is spent also with kids now that we have more time. Both of my kids are very involved in sports, and my daughter plays select soccer, so does my son, and my son also plays football for the school. So most of our weekends are spent on the soccer field or watching football basically throughout the year, since they're involved in the sports year round. So we keep quite busy with that. Yeah. And then as far as personally what I like to do, of course, we spend a lot of time together as a family. We enjoy traveling a lot, so we like to travel to new countries and new areas and experience new cultures together. That's one of our favorite things to do as a family. Things that I like to do personally, I'm very much into fitness and health. So I spend a lot of my time exercising and working on health and nutrition, and do a lot of my own research, and either by reading books or following podcasts, and basically self-teaching myself as much as I can to kind of better my knowledge, so I can use my knowledge for myself and for my patients. So I'm very much into like holistic and functional medicine. So kind of came upon that journey about 7 years ago, really became interested in that aspect of medicine, and try and incorporate that into my daily routine and my family's routine, and with my patients, just to help be more comprehensive for healthcare.
Awesome. So I heard both of you talking about, more time and just kind of the growth journey of just wanting to do some better care, right? And so, yeah, so the second question, just tell me about your practice again one more time. Anything else special that's unique to your clinic? Just love to hear kind of I mean, you two were working side by side. Tell me a little bit about that journey. Did you ever just like, hey, like bumping shoulders or bumping elbows, and be like, hey, I think we could, there's this thing we can do, and I have an idea. Like, whose idea was it first,
So it was, I mean, it was like, we weren't like discussing a lot about concierge, but Dina's has a concept of concierge because of the friends, and she was trying to convince me. And then when we thought like, I mean, tradition, there's nothing wrong with the traditional. It's just that the volume of the patients is so much every day that you cannot able to focus. Every 15-20 minutes, you are seeing new patients. And that's not enough time to address most of the patient concerns. And then if the patient is coming with 2 or 3 symptoms, let's go ahead and reschedule. That's not the way we want to practice. So it was getting, as years went by, we feel like it's getting more and more worse. And we don't want to lose our passion for continuing as a physician. So that's why we decided to do concierge, which is basically one-to-one care. So you take a small panel of patients and who's interested in joining the concierge. It's not only our model is not only the cash model. We do take medical insurances. So we bill our medical visit through insurance, but we do have concierge fee, which is, I feel like, affordable, because we do offer installment plan, so the patient can able to afford it. And then those concierge fee, we want to keep it because we want to keep the panel small. And basically we spend 60 to 90 minutes with the patient, no rushing through the appointment. Same day appointment is more easier than before. We both are available for acute visits. We do not only focus on chronic medical problem, as Dr. Diehl said, that we are focusing on preventive and wellness, and we are incorporating more holistic approach so that we don't have to, we can target other aspect of life, which is nutrition, exercise, stress,
sleep,
hormone management, weight problems, which is very, very important in dealing with the health. So that was the concept, and we don't only do this, we do have other things that we offer. We have excellent screening tests in our office for cancer screening, for heart screening. We have different supplements, which is pure supplements that we offer the patients. And then we have, we both are board certified, so we do manage a lot on weight and hormone management.
So I think that, I mean, Dr. Med basically covered it, but I think what's unique about our practice is that, we are board certified internal medicine, obesity medicine, and we also incorporate functional medicine, and it's a concierge. So it's very hard to find all of those things under one roof. So, a lot of times you might go to a weight loss doctor, or you might go to your internal medicine doctor, and then there's functional medicine providers. And so we just kind of put all of that under one roof to make it more comprehensive for the patient. So really the patient's investing in their health here, and we are taking all the time, we're personalizing their approach, and we have a lot of different things that we can offer for the patient that you are definitely not going to get at a traditional practice. And even another concierge practice may not offer all of those things because of the different various certifications that we have.
And we honestly, we focus on everything, but since we are two female physicians, we focus a lot on women health and hormone, because we can feel what they're going through. So that's, and me and Dina have excellent network with the specialists. So if the patient needs to be seen to the specialist, we have excellent network with the specialists in Plano and Frisco. And we tried our best that our patients are seen with the best specialists on a timely manner rather than waiting for 3 to 6 months.
Yeah. Awesome.
And I think the other thing too is, it's just Dr. Ahmed and I here. So there's no, nurse practitioner or PA, which is that's fine if there are those in the practices. But I think the point in that is that we are constantly the ones taking care of our patients, and we're the ones calling them and communicating with them. It's not a nurse or a PA. Sometimes it's communicating with the patients or following up with the patients. So the care is not disjointed. It's, definitely more continuous because they have us as their primary provider.
And especially on the weekend.
I can relate to that.
Yeah, especially on the weekend. I mean, a lot of time when we were in traditional practice on the weekend, we are covering each other. We don't know the patients. We are directing patient to the urgent care and care now. I'm just talking about our practice. I can't speak on the behalf of other traditional physicians. Maybe they practice differently. But here on the weekend, we are available. I mean, they have our personal cell phone number, and they can contact, and most of the time we can able to help them and prevent the ER visit, ER admissions. So they have to understand that we're also preventing a lot of cost for unnecessary ER and hospital admissions.
Yeah, awesome. Yeah, I mean, I remember one time doctor similar to you, he's kind of concierge, and it was very nice of them to say, hey, I'm not feeling good, these are the symptoms I'm having. And, it's like, you need to jump on a call with me or whatever. And, I sent a picture of my throat. I was like, look, I got inflammation. And I was like,
we've done that before. Yeah.
Yeah, I know. I feel like it's a weird picture or whatever. But, he was able to, just order, hey, you might need a little thing of antibiotics. Rather than me going to, an urgent care and paying $300 out of pocket. It's just nice that,
300 plus, they don't know your medical history.
Right. They're just,
Exactly.
And plus we are available then on the clinic hours. And if they're not feeling well, okay, just come over and we'll see you guys.
Yeah.
So it's a very convenience, I feel.
Yeah.
And we see various ages. So we see people that are, we see kids, young adults, 18 and over, that might be busy with college and things of that sort, they get sick, and the ease of getting in to see us. Then we see, middle age, which, may be very focused on their preventative health, or they're also busy with their careers and need to be seen in a timely fashion or travel and want to make sure they have access when they're maybe not in town. And then we see, of course, elderly patients, Medicare population, they have chronic medical problems. that just require more time because of their medical issues. So we see all across the
Yeah.
board people for different reasons.
Awesome. Yeah, and I think another thing I heard was just I had a thought. It didn't flew by. Oh my gosh. But yeah, I mean, it sounds like y'all's practice is doing just great things. Oh, I know what it was. I was saying earlier, I relate to the fact that like, you know, your clients or your patients are getting to see you directly, the person with. I mean, it sounds like both of you put in just tons and tons of work of just not just medical school, not just, you know, residency, but just continuing to educate yourself on the newest things that are happening, the newest research, and they're getting to work with you directly versus like I have a very same kind of principle too. It's like when somebody schedules at our clinic, they're working with a therapist most of the time rather than a technician or something like that. That yeah, maybe they be able maybe to implement some good things, but a skilled provider is going to know how to adapt their treatment based on what's going on and what they see. Like you said, you know, y'all have eyes and ears and things to see, you know, and just know what to do when it comes to just delivering a good patient care. And so, yeah, I can relate to that so much. Yeah, I guess, and the last question I have, yeah, we got plenty of time. If you have any more things to say about your practice, do you have any things to say about your practice before I go on to the next question?
I think that's pretty much who we are. We
Yeah.
do have a website. They can always go
Okay.
on the website,
Yeah.
Signature Internal Medicine. I just want to add one thing that anytime anyone is interested in joining us, we do offer complimentary meeting. So
Okay.
they can schedule with us. There's no obligation to sign up, but at least they can come, have a tour with our clinic, with a provider, with our staff. They are most welcome to come.
Yeah.
We do those all the
Awesome.
time.
Yeah. I'd love to. Where exactly, what part of Frisco are y'all located at?
So we're located in a medical office building, which is right north of the Texas Health Frisco UT Southwestern campus. So we're basically right in between El Dorado and Panther Creek off the tollway. So we're in the medical community up here.
Okay. Awesome. Yeah, I'd love to come up there and check out y'all's clinic sometimes too.
Yeah,
Nice.
Yeah. Well, yeah, if you could, after this call, send me a link of a ways to kind of, for our listeners to kind of get connected with y'all. I'll get that done.
Yeah.
And then the last question I have, I always love to just hear about like, well, I think you've answered some of it, but what is the unique client that you like to work with, or maybe just even a patient testimonial that y'all would like to share? Can y'all think of anything to share about those two questions right there? Just maybe your ideal patient, you know, for me, like what I like to say is just someone that's committed to their care, you know.
And that's exactly I was about to
yeah.
say.
I think patients, you know, I think, and this probably goes for both Dr. and Men, I think patients that are really vested in their health. So when they're coming here, they're really vested in taking care of themselves. And when you have a patient that wants to work on themselves, it makes our job a lot easier because they want to improve, right? And so I think that it definitely makes everything a lot easier for us. And
honestly, Larry, everyone deserves and everyone wants to have personalized care, in my opinion.
Sure.
Exactly.
Everyone wants to focus on their health and they want to put their health as a top priority. It's just that they have to make the priority.
Yeah, they have to make it.
They have to take out the time to put investment in the health.
Yeah.
The way we do investment and other stuff.
Yeah, exactly. Yeah.
We have a great success story, and we can share tons with you. Comparing from traditional to concierge. The long story short is, if you get something, if you diagnose with something, it's more easy to help the patient with moral support, with the treatment. Everything is on the timely manner. And
in this kind
of a practice, you cannot, in our opinion, because we work both together in traditional practice for 10 years, it's not humanly possible to provide personalized care to each and every patient.
And take the time to really get to know your patients. I mean, you don't get enough time in a traditional practice to really dive into their health, to really get to the root cause of why they're not feeling well. A lot of times, okay, well, here's a medication, and then when you move on, that's not the right way to practice. Unfortunately, that's kind of how our system is defaulted because you don't have enough
Yeah.
time. And so, medication is a quick fix, but if you really take the time to understand why the body is doing this and what is going on, you're better able to serve the patient. So we have lots of success stories of patients that come in, and after you really dive into their health, that we're able to help fix them, where before maybe they would have been sent to a specialist or given a medication because it's what gets done, right? But now we just really take time and we invest our energy into really.
Plus, you have a freedom. You have a freedom to make a clinical decision what is best for your patient, rather than directed by the insurance companies.
Exactly.
So
yeah, exactly.
So that's the biggest difference, and I think everyone should consider a concierge, at least give a try.
Yeah, and I think I heard too. I have a success story about myself working with a functional medicine doctor. Not that I've worked with you guys, but my experience with a functional medicine doctor, was definitely totally different. So I'll share a little story about myself and share some medical information about myself. But I was diagnosed with pre-diabetes 2 years ago, which 38, that's too young to be doing that. And granted, it was probably my fault, just eating lots of bad food and just running, trying to start my company. But 2 years ago, I met with this functional medicine doctor, and I think I heard y'all said y'all do supplements and stuff like that. And they got me on a bunch of supplements versus immediately putting me on metformin or insulin or whatever. They were like, hey, your A1Cs are high, but you being so young, we think we can reverse it. And yeah, it was reversed. It was so crazy. And like I took the diagnosis of diabetes pretty emotionally hard because both my parents are diabetic, and diabetes, when you have it for such a long time, it messes up your body. From your kidneys failing to your heart not doing so well. Now my dad has dementia. I think I was sharing with Dr. Ahmed a couple weeks ago before we scheduled this call that like my dad now has dementia, which probably has to do a lot with his diet and his diabetes. And so I took it pretty hard. Like I was like in tears when I got that diagnosis. But the fact that like my primary care physician was like, hey, I want you to go see this functional medicine doctor. And I had no idea what it was. And I think there's still a lot of people out there that don't know what functional medicine is. But it is like, I think you said earlier that it's fixing the problem, versus covering it up. Right. And I relate to that a lot too here at our clinic. We try to fix the root problem versus, hey, like, let's just do these check off movements that is a protocol that we think will work for you. No, we're going to sit down and do a proper diagnosis like we do here. So I like working with doctors like you guys because I know y'all are going to do the hard work. And so, but yeah, that's my success story. So I'm sure y'all got something like that for sure. Yeah.
Absolutely. I mean,
I think
that's what we do.
Yeah, I think in the traditional practice, I started realizing that I wasn't able to fix patients, that there was something else going on, that I needed to understand the patient deeper. So that's when I got into functional medicine about 7-8 years ago, really dove into it, got certified, went through all the modules and really understood. And so now I use that and I weave it into my internal medicine background so that I can really help understand, how the patient's body is working. So I really much like to look into adrenals and hormones and gut testing. And I do very detailed vitamin panels on patients and metal testing and all different things that really can impact your health so that we can get a really good picture as to how to approach the patient. So very much similar to your experience. I mean, functional medicine really is kind of the way that medicine should be taught in practice. And so it's a newer approach, but it's actually been around for 20 plus years. It's just more
awareness
are becoming aware about how to incorporate that. So.
Awesome. Well, any last thoughts or questions? Y'all have any questions for me? We're so far apart. I don't know. I don't know. I'll definitely try to send you some people, but I don't know if y'all work with any Richardson people. But if y'all do, y'all know I'm around. And so
definitely we would like to have your brochure as well.
Sure.
So if you have a chance, just drop off, and we just want to say thank you to you to giving a chance to let people know that we exist here and we are ready to help everyone.
There you go. Thank you very much.
Awesome. Yeah, thank you for your time. Y'all have a good rest of the day, and I'll have this podcast up today, so maybe we'll send it out for July 4th So happy July 4th for y'all tomorrow as well. So
Perfect.
you.
Thank you, Larry.
Have a good
all right,
night.
take care. Bye-bye.
Bye. Talk to you soon.